Hello, and welcome. Today you are going to learn how football players take advantage of Tecartherapy. We are also going to talk about the first digital library and the energy car. To start today's program, we are going to take a look at new solutions to regenerate the tissues in our bodies through radio frequencies. Football clubs are the principal customers. Let's start by knowing where Tecartherapy may be indicated and applied. Almost 70% of the human body is water, a good conductor of electrical energy. Besides some chemical phenomena inside the organism, this characteristic makes the human body a bioelectricity source. This is the principle which gives birth to Tecartherapy and Tecartherapy. Both systems use radio frequency to regenerate tissues in the body. The difference between them states on the richness, or poorness, of water in the tissues to treat. This is, Tecartherapy is specifically used in those tissues with a lack of water. Meanwhile, Tecartherapy is used in those tissues which are rich in this liquid. In both cases, the body accepts electrical energy through the active plate, which is driven to the other plate, the passive. Physiotherapy, sports medicine, and in general, traumatology, are the main applications of this method. First, we need this plate on the feet, which is called passive, and which is combined with other types of electrodes that we are going to use here. In this case, I am going to apply the plate right under the injured muscle. In this area, I have good contact. I am using a type of system which is called resistive method. The resistive method treats tissues poor of water, like the bone. In this case, this is the organic dominating element, so we use Tecartherapy. All the cells in our body, in between the two electrodes, active and passive, alternate their charges and produce a movement according to the electrical field which is created. This effect is known as the condenser field. We increase vascularization. Now we nourish cells, we provide more oxygen, and, on the other hand, we remove all the toxins and metabolism waste products, which are harmful. All these changes will restore the cellular plasmatic membrane. The scientific community has increasingly seen day after day that cell stimulus and tissue oxygenation is a more significant method for tissue health. This happens because the membrane is responsible for the communication with the organism, and it is the one which decides what shall come in and what shall come out of the cell. If the membrane is altered, it does also modify the exchange system with its outside environment. It has achieved. There are no miracle cures. Both methods have exposed to be very efficient in cases of tissue regeneration, endorphin and cortisol release, increase in arterial, venous, and lymphatic flows. Nevertheless, their effect is limited if there are other problems. If there is a physical problem, such as a mechanical block, the mechanical problem must be solved. For example, in case of treatments in the column, if I see that there are joint locks at that level, beyond the process of pain which is experienced by the patient, I must set that first. I can relax the tissues in this area. I can reduce pain. But it will come back, because the cause of the block comes before the others. Tecartherapy is indicated for those tissues which are rich in water, and, consequently, they are good conductors of electrical energy. It does also have aesthetic applications. In this case, we use the capacitive method to treat skin disorders. When you work with a method without passive plate, effects of the stimulus still have a depth of 6 to 8 centimeters. Regenerative properties of Tecartherapy and Tecartherapy are scarcely known in Portugal. In the specific case of rehabilitation and physiotherapy, there are only 2 machines in Portugal. One of them is located in the High Health Technology University School in Lisbon, and the second is located in the Oporto Football Club. We have as our guest today Mr. Pedro Fernandes, who is a technician in acoustics technology. Thank you for being here with us today. Thank you. We have this new technique which is being used. What is the basic idea of all? Is it everything to do with deep hyperthermia? Exactly. What is the evolution? How did you get to know it? Deep hyperthermia is a concept which appeared, and its use is widely extended worldwide. Simply, Tecartherapy is a post-deep hyperthermia. Deep hyperthermia is a way to generate an increase in temperature in the human body, or in certain areas, to cure a problem. Is that correct? Fever, and the body forces a larger supply of blood, a more intense flow in that area which will oxygenate and send more nourishment. And what is the evolution towards Tecartherapy? For Tecartherapy, within the same concept, we create a little inner fever, simply the electrical transfer between the active and the passive plate. Activates the cell membrane, forces it to increase the flow, to improve communication between the inside and the outside. Consequently, the introduction of nourishment in the inside is enhanced with this technique. Then, can you precise what are these electrical transferences? It is a totally harmless therapy, non-invasive, of radio frequency. Of very low frequencies? Yes, of very low, very mild frequencies. Fortunately, you do not feel anything during the treatment. The patient can even doubt about the treatment, because sometimes he does not feel anything at all in the beginning, but after the treatment, he can feel the results. How long ago did this technique appear? This technique appeared 2 or 3 years ago. In Portugal, it has entered very slowly. Before introducing the machines and looking for sales, we were more interested in doing studies in specific practical cases. Is that what the High Health Technology University School in Lisbon is doing? Exactly. In Lisbon, we have done a protocol with the university to do studies. Some studies which are now about to be published. On the other hand, we train to those people who are interested in the school premises. And we have some published works on their hand. And it is only the students in the university who can learn? No, any student in the school can treat himself and perform this therapy on others. Anyone who wants to see and wishes to experience is invited. If by any chance, any physiotherapy treatment that anyone is being applied has no good results and you want to experience something new, you can come for free to the High Health Technology University School in Lisbon and get some treatment. Pode gratuitamente ir à Escola Superior de Tecnologia da Saúde em Lisboa e fazer esses tratamentos. Anyone can just go and ask for free therapy? Yes, totally free. Exactly. What I would like to highlight is that this type of technology has 2 targets, 2 objectives. You can apply it for clinical reasons, let's say someone who needs treatment, but also for aesthetic reasons. Is this correct? Exactly. Consequently, these are different areas. Either aesthetics or physiotherapy. When we talk about lymphatic drainage, obviously, either a physiotherapist or a good skincare specialist can both obtain the same result. Even more, we do have Tecartherapy machines, which regenerate tissues which lack of water. The bone, for example, exactly. The bone, cartilage, and Tecartherapy, which are devices which do that regeneration specifically in the tissues with a large percentage of water. In this case, skin, muscles. The ones who can benefit the most of this technique are athletes, don't they? Exactly. The Porto Football Club does have devices like this one. Is that correct? Exactly, they do have machines. And what do they think about this? Are they happy? Yes, they are happy. They are satisfied. It is a club with a minor number of injuries. All the players have an inferior number of injuries than other teams, and, besides, they recover quicker after them than any other team here in Portugal. And this started in Italy?